Hello, my name is Leanne, and my group members and I will be discussing the condition known as conjunctivitis. We'll explain what it is, the symptoms, the treatment needed, the worst and best outcomes when it's left untreated, the most and least expensive treatment available, and who to get help or information from.
Conjunctivitis, commonly referred to as pink eye, is an inflammation or infection of the eye. The conjunctiva is a thin membrane covering the inside of the eyelid. Bacteria, virus, and allergens are the three most common causes. Viral conjunctivitis is similar to upper respiratory tract infection in that the worst symptoms occur in the first 3 to 5 days and generally resolve in 7 to 14 days. Bacterial conjunctivitis is usually caused by Streptococcus, since the bacteria live on human skin and other household items such as makeup products. Grass, pollen, tree flowers, and ragweed are the older possible of allergic conjunctivitis.
The common signs and symptoms of conjunctivitis are redness in the white of the eye, called the sclera, and swelling of the eyelid. Bacterial conjunctivitis causes a yellow or green discharge, crusting on the eyelashes and increasing tear production. These signs can also be caused by respiratory viruses. A common symptom is the feeling of having something in your eye, or a gritty sensation. Additionally, the eye may exhibit light sensitivity, accompanied by pain and decreased vision, which does not resolve after cleaning the eyes.
When left untreated, symptoms may persist or even worsen. Viral and bacterial cases can be easily resolved with medication and the correct treatment. However, allergic reactions may have more serious effects, and they may go for longer periods of time throughout a person's life.
Most forms of conjunctivitis do not rely on treatment to eliminate inflammation or infection of the eye. Viral conjunctivitis, the most common overall cause of infected conjunctivitis, usually does not require treatment, and the varying symptoms subside within days to weeks. The second most common cause of infected conjunctivitis, bacterial conjunctivitis, also does not require treatment normally.
The most expensive option for treating allergic conjunctivitis is through sublingual immunotherapy. So this involves spraying a small amount of the allergen under the tongue in a special solution to help the body to get used to the allergen. But it is expensive. It's around $150 to $200 per round, and it may take several rounds to actually work. So even though the evidence for this therapy suggests that there is a moderate improvement in the short term, this might only be a good option to consider if the allergies are particularly severe or occur all year round. Antihistamine drops are the cheapest medicinal options, around $5 to $10 a bottle, and they help to stop the body's immune system from sending out alarms. The evidence for this method has a low risk of bias, which basically means that the reported improvement after use is likely to be accurate. It's not really clear which kind of antihistamine works best, but the side effects are minimal, so you're welcome to try any. In combination with this, we would recommend managing the symptoms with cold compresses and artificial tears.
For viral conjunctivitis, there is no treatment currently available. However, symptoms of inflammation in the eye can be eased by using topical corticosteroid drops, which is the most expensive form of treatment. Compresses being placed over the eyes, as well as artificial tears, can rapidly improve the state of the conjunctivitis, and this method of treatment remains the most affordable. For bacterial conjunctivitis, ophthalmic fluoroquinolone is rather high in cost in comparison to other antibiotic medications used to treat this form of conjunctivitis. The topical ophthalmic antibiotic medication is seen to produce very similar results to other antibiotics and is also the lowest in cost out of all the agents. Therefore, it is a highly desirable treatment.
If you suspect that you have conjunctivitis, you can go to your general practitioner. They will ask you about your symptoms, examine the eye, ask about medical history, and make you read a chart to check your vision. If they expect that you have conjunctivitis, they'll do a swab of your eye and send it to the lab for testing. This will give an indication of the type of conjunctivitis and the best way to treat it. They can prescribe medication, eye drops, and ointments, and give you more information about the conjunctivitis.